let me kind of start off with a video of what Google sees as the future of health and AI. And then I'll kind of pick up from there.
Should be unique too. What if someday you could have personalized health insights that honor your strength, your resilience, your family, your needs as they evolve every day? Over the course of your whole life. In the future, your health journey should reflect everything that you are and help you make the right choices for your body. Because you contain multitudes.
Right, so now what you saw there, right, was essentially around three tenets. And the way that we understand and the way we believe at Google how health will evolve, and we're already seeing that adoption happening in India. Basically, there are three large areas where we see the impact of technology, right? One is on the consumer side, which is patients like us and consumers like us. How will we use technology and how will we use artificial intelligence to impact how consumers will consume health, right? Because, you know, there was a great stat put out there that 87% of India today is connected to the internet. 82% people have a mobile device, right? Most of us are on 5G and 4G and Edge and whatnot. And there is essentially connectivity that is available. How do you influence consumers to take better control of their health? That is the first kind of tenet, right? What you sought there in the future of health, whether it be taking a camera, scanning your eye and checking if you have diabetes, whether it be checking your heart rate with your phone and covering your finger with the camera of the pixel. These are things that are all kind of live today, right? The second is doctors. And, you know, how do you work with doctors to make sure that you have artificial intelligence helping them really boost the work that they're doing, right? Because at no point of time will artificial intelligence replace a doctor or will it become a doctor, right? But it is probably going to boost the 20% tasks that the doctor does today and bring in efficiency into that. And how can you have agents working alongside, and this I mean artificial agentic workflows, what we call artificial agents, or as you folks commonly know as bots, right? How will these bots work along with your doctors to make sure that they're helping and assisting the doctor? The second is, how can you use artificial intelligence to reduce burnout of doctors and nurses? I'm sure all of you are, you know, everybody works in the health ecosystem. Doctor burnout is a huge, huge issue, right? And how do you really make sure that you're using technology to reduce doctor and nurse burnout? And that's a large focus area for Google, and I'll talk to you about some of the tools that we're building there. And lastly is community. How do you use the vast amount of data that is coming from all of us, right? All of us are wearing wearables. All of us are, you know, tracking our data and our health on a daily basis. Can you make this data available so that you can understand at a population level what is happening and then personalize that healthcare for consumers, right? So these are the three broad areas where we feel artificial intelligence and technology has a major role to play in India, right? But India is a complicated story, right? India is not a typical US model that you can take and deploy. India in healthcare in India is a tale of two halves. It's a tale of two cities, right? It was the best of times, it was the worst of times, right? And the way that I like to break this down is very simple, right? Hey, we have life expectancy that has gone up drastically in India, right? People are living for longer. I think the average age is now 67. This means that a person is living for longer. And when a person lives for longer, they have health issues that come up longer. On the flip side, our doctor density has dropped down drastically, right? So from, I think, 1991, it has dropped from 10K doctors for the population to, I think, some 7.3, right? So doctor density is going down. which means that we just don't have enough doctors to service the population that is aging, right? Can technology really make a difference there, right? Can people that are aging take better control of their health? Can they understand their health symptoms better, right? So on and so forth. The second is, I think everybody spoke about today, the minister spoke about it today, Dr. Tharoor spoke about it today, about Ayushman Bharat, PMJ, all these great schemes that have come up, right? And I think public spending in India is increasing, but having said that, we are one of the lowest countries that's, does public spending compared in healthcare, right? I think the average is 11%. We are somewhere around 3.7%, right? Which means that there's huge opportunity today for us to look at how to make healthcare accessible to the entire population of India, right? On the flip side, if you look at it, we're seeing that healthcare innovation dollars in India are increasing, right? So by 2028, and this is a report published by Bain, they say that $60 billion is going to be the healthcare innovation market in India, which means to say that that much of dollars are going to be poured into India to make sure that healthcare, health tech, pharma, all of the technology innovation in this really increases, right? So while public spending is low but increasing, I think there's been a great initiative by the government over the last 10 years, and I think with infrastructure improving, this is going to leapfrog, and then money being poured into healthcare innovation, right? So it's all looking, it's a tale of two halves, but on the positive side. Lastly, I think it's known, we carry a very high disease burden. I think it's an interesting stat that in 27% of the deaths that occurred in 2017 were because of cardiovascular diseases. And it's a known fact that we're the diabetes capital of the world, right? But on the flip side, if you look at it, 82% of consumers today want healthcare on their mobile phone. What does that really mean? That really means that people are willing to take control of their own health, especially on chronic diseases, right? Especially when you look at diabetes management, especially when you look at heart diseases. Everyone wants to understand their health a lot better. And this is where technology, artificial intelligence, machine learning, all of these play a vital and critical role, so that you're trying to keep the consumer, the patient, as healthy as possible, right? So that the burden on the healthcare system is reduced drastically, so that you prevent doctor burnout and so on and so forth, right? But that's essentially, what we are seeing, and you'll be surprised to know that 75% of the leading healthcare companies globally, even in India today, are adopting generative AI and AI. So I think the question is not on why should we do generative AI, or why should a health system, or why should a pharma company, why should anyone invest in tech, and why generative AI. It's more about how do we do it, right? And I have a few examples here that will give you a sense of how two of the largest healthcare systems in India today are leveraging AI and machine learning in their workflows to help patients and to help doctors, right? Before that, where are we seeing the adoption of Gen AI in healthcare? If you look at it, in India, there are 4 areas, right? One is patient-consumer engagement. How do you make sure that you have products and tools available today to engage patients in a much more holistic way? An example, and I'll show you a video of this, of how you can, how you look at a patient concierge, right? And how do you help a patient through conversational AI in natural language to understand their symptoms better, to understand how to get to a hospital and clinic better. The second is around caregivers. How do you work with clinicians and clinical teams to build in AI into the workflows? A great example is nurse handover. Right? If you really look at nurses, right, the change of every shift, there's a lot of information that gets missed out. Patients suffer, discharge gets delayed, all of that. How do you enable something like a nurse handover with artificial intelligence so that the nurse can just ask questions about the patient that she is receiving and get much better information? The third is around longitudinal health. And when we say longitudinal health, we mean very simply getting a 360 view of a patient, right? How do you make sure that all the tests that the patient goes through, all the surgeries, diagnosis, etc., is available to a doctor easily? And how can they search on that, right? How can you type that, does this patient have diabetes, in your EHR, and then actually get an answer from there. Just like how you search on Google, how can you enable that for a doctor? And that's something that we're seeing huge uptick on, because it's helping doctors understand patients better and diagnose them faster and get to their diseases faster, right? And it's really fantastic, the tech, because we've taken Google search and we've basically contextualized it for healthcare, right? And that's what we're seeing largely in hospitals. And the last is around personal health record. This is gaining huge traction in India. You know, we have folks from Apollo today in the room. Apollo's deployed a PHR in their Apollo 247 platform, where you can actually access your health records even if they are not Apollo records, right? You can basically go into the application, take a photograph, store your health records, it'll digitize your health records, and it'll do a whole lot of the good stuff today that, you know, you have to carry a file. Like, we still carry a file to a doctor today when we go, right? Instead of that, you know, how to build a personal healthcare record that is actionable, right? So it's not about just uploading a prescription and taking a photograph of your medical record, but really, can the PHR be built as a product that can help you understand, because now you've taken a photograph of your report, but it's actually digitized that, taken out information, it's told you, hey, you may be at heart risk, hey, you know, your next surgery is due on such date, it can contextualize your medicines for you. So personal health record is a huge, huge area where we're seeing a lot of health tech, health startups doing it, Apollo's doing it really well, you know. So we're seeing this journey in India, and we're seeing number of use cases, number of consumers and customers adopting this. I'll talk to you about two. I'll talk to you about Apollo Hospitals and Manipal Hospitals. Both of them are working very closely with us in building out very high-end, sophisticated systems powered by AI, right? And I'm going to play a video which is from the Apollo team. You know, this is the work that we've done with them.
Imagine a world where healthcare is as intelligent as it is compassionate. The Clinical Intelligence Engine, or CIE, brings this vision into reality. At the heart of CIE's brilliance lies a fusion of Apollo's proprietary clinical knowledge graph and models built using Gen AI, transformers, and other Google Cloud technologies. Let's look at how a user would interact with CIE-based tools, right from reporting symptoms to receiving prescriptions from a doctor. Meet Meeta, a 37-year-old woman who is experiencing palpitations and lightheadedness. She begins by keying in her symptoms on Ask Apollo, an on-demand symptom checker powered by CIE. She starts by reporting her chief complaint, experiencing an organic exchange thanks to NLG powered by medical-grade Gen AI. Upon completion of the inquiry, CIE's inference engine, built using Gen AI, presents Meeta with contextual information, including the differential diagnosis, lab and imaging tests required, and the medical specialty most suited for her case. These insights help Meeta take the next best step, which is booking an appointment with a doctor of her choice for a virtual consultation. While Meeta is guided to her doctor's virtual consultation waiting room, as the doctor enters the consult room, CIE uses medical-grade Gen AI to present a comprehensive case summary including history of presenting illness and past history of the patient. Meeta's past medical history from the Apollo database seamlessly flows through the EMR using Gen AI's NER capability. Next, CIE performs a case analysis with its inference engine, built using Gen AI on Apollo's proprietary knowledge graph, suggesting differential diagnosis, clinical triage, as well as lab and imaging tests. CIE's vigilance is further fortified by the system proactively flagging potential drug interactions for doctors based on Apollo's proprietary drug database, prioritizing patient safety. Patients, on the other hand, receive safety information about their prescribed medication in user-friendly format, curated by Gen AI, which empowers them to make informed decisions. From inquiry to diagnosis, recommendation, and patient education, CIE isn't just an innovation. It's the driving force behind clinical decision-making.
Right. This is some fantastic work that Dr. Madhu and the Apollo team has done, and I think it's really changing the landscape of healthcare in India, because at a consumer level, if you go to Apollo 247 and start entering your symptoms in Ask Apollo, it will actually give you some diagnosis, right? And then you can do next best action with that. So it's a great, fantastic use case, already live, already deployed, right? And really changing. The next, example that I want to talk to you about is with Manipal Hospitals, right? Manipal Hospitals is also doing some very interesting work using generative AI. One of the main things that they wanted to do was to digitize handwritten prescriptions and provide a summary of prescriptions to patients with doctor handwriting. Right? It's a huge, massive use case in India, because 90% of our doctors still handwrite their prescriptions, and it becomes very difficult then for a patient to understand it and then keep track of it and all of that, right? So Manipal Hospitals has started a e-pharmacy business in Bangalore, and they're obviously expanding it across India. But essentially what it does is it takes a prescription, digitizes it, and gives a summary, right? And it's a very, very powerful use case, because they're able to service the patient once they leave the hospital with a digitized prescription, and then you can order through the Manipal e-pharmacy platform. But I think the overall experience that they're trying to drive is provide a platform for patients to just make sure that their prescription data and their diagnosis is available to them very readily, right? Again, right, they used Google Tech all across, but let's just kind of go through this very quickly. Let me speed the pace up. Let me space it up there. So if you see, this is a handwritten prescription, right, of some XYZ patient. It's not a real patient. It's and then it's handwritten, and then it uploads the prescription, and you say generate a summary, right? And essentially what it's going to do now, you'll see it's captured the patient name, hospital number, it's given the doctor's notes, it's captured the medicine lists, it's done all of this at the click of a button, right? And it's essentially now made the entire prescription digitized, contextualized it, put it in a format that is understandable by a layman, right? And then now you can now use this prescription to order medicines or take it to a doctor or just store it for your records, right? Because one big thing in India is that, hey, we kind of tend to forget what medicines we were prescribed, right? So this is another great use case that we are working with Manipal. Of course, there are some other things that are in the pipeline with them as well, right? The last thing that the one other example that I'd like to give you was on patient concierge, right? Remember I spoke about how you can build tools and technologies for patients to interact with you better, right? This is an example of, what we're doing today with one of the health systems in the US. This is a demo video, but this is something that now we're building out in India as well. I can't, name with whom, but, just take a look at what it's trying to do. I'll just pause it for a second. So what you saw on the appointment side, we've just launched that with Cloud9 hospitals. So basically it's called Bump. The bot is called Bump, and it's on WhatsApp. So if you go on WhatsApp on Cloud9 and you try to book an appointment and get your tests, etc., through WhatsApp, the entire tech at the back is Google's tech, but you can get your reports, you can book appointments, all of that by having simple conversations like this patient is having, and you can do it in English and Hindi as well, right? So the idea is I'm trying to tell you that some of these are, already being adopted at scale, right? Now, this is the next step. That's interesting, right? The AI bot says that it's not a qualified doctor, right? So to answer any question. So it's very critical that as customers and as all of you look at and interacting with artificial intelligence, either providing it to your patients or consumers, you have to make the boundaries very clear, right, for these kind of experiences, because you don't want artificial intelligence suggesting to patients what could be a diagnosis in a way that they can take action without having to consult a doctor. And hence the bot here says that, hey, I'm not a qualified doctor, I can connect you to somebody, why don't you want to find out, right? But I think you get the general idea. I'll not go through with the whole video, but essentially what we're seeing now is essentially that, how can these technologies be leveraged to drive better patient-consumer experiences and better doctor experiences in a nutshell, right? The way that we're doing all of this today, just so that there's full confidence in how some of this is being done, right? If you really look at it at the back end, right, we use something called as a large language model, and that is the entire basis of generative AI. These are large language models. We have a medical grade large language model today that was able to pass the US medical exam and get a result of 85.4%, which basically means that it was able to perform really, really well, because I think the passing grade is 65%, right? So it got to 85% of accuracy. So it's a great tool and technology that we use to build out some of these products that you have seen, right? We've now expanded that to imaging and multimodal. What does multimodal mean? Basically, it's not just text, it's voice, video. So essentially, if a patient says that, hey, my HB1AC is 7.5, the model is able to understand what is HB1AC. So it's able to understand that, hey, this patient is diabetic and so on and so forth, right? So you're able to interact with these systems now almost like how you would interact with a human, right? But again, it's not taking a decision, it's just helping you. Look at the area of imaging. It's huge, right? Because today you can annotate images, you can identify lesions in a lung, you can look at tuberculosis, and there's a video of the work we're doing with Apollo at Impact in India on how we're helping TB. But you can use all of these technologies today to really get more accurate information on how a disease is progressing, right? And how whether the patient is at risk of having lung cancer, right? And it's really fantastic, right? As to how some of this is being done. This video will give you a sense of how Apollo and Google work together for tuberculosis in India.
અમારું નામ છે ધારસીભાઈ નાનજીજી ઠાકોર, ખેતનું કામ કરે છે અને પશુપાલક સાથે કામ કરે છે. એટલે અમને ખાંસી આવતી હતી અને અંદરથી શ્વાસ પણ એમ સરતો એવું થતું હતું અને શક્તિ કમ પડતી હતી, વજન ઘટી જતું હતું, ઝીણો ઝીણો તાવ રહેતો અમારે, આમાં તકલીફ બહુ થતી. અમારું પશુપાલકનું અને અમારા છોકરાનું અને અમારા પત્નીનું આ પાછળ શું થાય એવું. પછી અમે રિપોર્ટ કઢાવ્યો નજીકમાં ધાનેરા જઈ, ધાનેરાવાળા ડૉક્ટર કાંઈ રિપોર્ટ બતાવ્યો એટલે ધાનેરાવાળા સાહેબે કીધું કે તમારે આવી રીતે છે આમાં કે.
My name is Dr. Srinivas Raju Kalidindi. My father was a doctor. He was the only physician for the entire village. But all he had was a stethoscope and a microscope. There was no technology of any kind. So he saved a lot of lives. So that is the reason in my decision to become a doctor and also become a radiologist. India is a country that has about a quarter of world's TB burden. Approximately 1.3 million people died of TB in 2022. Under 400,000 were deaths in India. Good afternoon, everyone. So I'm going to be talking today about TB. TB is an airborne disease. It enters the lungs and it can cause infection within the lungs. It can cause cavities, it can cause abscesses, it can cause accumulation of fluid around the lungs, and it can spread to other organs, and in some cases can be fatal. If TB is treated promptly with medication, the lungs can become healthy again and the patient will be cured. It is not acceptable for a curable disease to kill so many people in the modern age.
I've been at Google now for a long time, over 16 years, and for the last 6 years I've been working pretty much exclusively at this intersection of health and AI. We've been partnering with Apollo Hospital and Dr. Raju and his team for several years now. We have an effort in the use of AI to detect tuberculosis from chest x-rays as a means of triaging. We need solutions that could be scalable and are cost effective so that you could then detect tuberculosis early enough and thus reduce the spread in communities. And for the case of AI for chest x-ray solutions, it felt like a great fit.
One really good example of how AI can be used is having a van going into the villages with an X-ray machine on board. The patients can come, have a screening done, and then also have their X-ray done. And the X-ray will then be transmitted to a central location where AI can give an immediate interpretation about the likelihood of TB. And this interpretation will later be confirmed by a radiologist. It will act as an aid to the radiologist so that they can make the diagnosis more quickly and more effectively.
મળતા સુધી સગવડ એટલે અમારે આગળ જવાની જરૂર નથી જલ્દી અમારું નિદાન થાય.
My father had a lot of patients who had TB. If he had access to something like this, I'm sure he would have been able to treat a lot more patients with TB and probably save a lot of lives. My father would have been extremely excited.
Great example of looking at how you can create, how AI can create impact at 10x, right? In Google, we always talk about 10x thinking, which is to say that how can you have an idea that can really take something to 10x, right? And this is a great example. I'll talk about two things very quickly. I have another 2 minutes. One is connect to mix, right? This is a term that Google coined, right? It is a way, so I mean, most of you know that the human brain today is still a mystery. We've not been able to understand the human brain, we've not been able to predict Alzheimer's and so on and so forth, right? There's an ongoing project in Google in research on how we can map the human brain. So using AI and machine learning and the vast amount of data that we have, we've been able to do this for a mouse. Because if you actually look to map the human brain, it's going to take infrastructure today that is not available. It's going to take years. I mean, it's going to consume like millions of years to do that. But we've managed to do it with the mouse because the mouse brain is very similar to a human brain, right? So we managed to now map the brain of a mouse. So it's a real breakthrough, and this is in research. We'll soon be kind of, making it more publicly available so that you can start understanding diseases like Alzheimer's and mental wellness and all of the things that were spoken today in a much more precise manner using technology. The last is a project that is now available publicly. It's called AlphaFold. Protein structures are impossible to predict, and our body is made up of proteins. Folding of protein structures can give you understanding of diseases never thought about and cure to diseases that were not possible, cancer being a classic example, right? Now with AlphaFold, we've been able to understand the folding structure of proteins. We released this model last year. It's being adopted at scale for research in the US primarily because we are a generic manufacturer of drugs. US does a lot of the novel studies on drugs. So a lot of this is being used to understand if medicines for diseases that were never treatable, all NCDs can be used, because now you can, once you understand the folding structure of a protein, you can understand today how to attack the protein and how to attack the disease, right? So these are a couple of 3 ideas that I wanted to quickly touch upon on how AI is making a 10x impact in healthcare. Of course, it can continue to do what it does to improve operational efficiency and etc. and help you interact with consumers better. But that's the way we see the future of health at Google. We see this, making a meaningful impact, and we see, health and AI going hand in hand as you move forward as technology increases. So thank you for the time, and I really appreciate the week having me over, and I hope this talk was interesting. Thank you.